Have you been feeling tired all the time, thirsty no matter how much water you drink, or waking up in the middle of the night to use the bathroom? What if your body has been warning you about diabetes for years, and you never noticed? Diabetes is one of the most common health conditions in America. But here's the scary part, millions of people have it and don't even know it yet. And today, we're going to talk about the warning signs, what actually causes diabetes, and what you can do right now to protect your health. Slight pause. Let's start with the big question. What exactly is diabetes? Diabetes is a condition where your body has trouble controlling sugar levels in your blood. Now, sugar itself is not the enemy. Your body actually needs sugar for energy. Every time you eat carbohydrates, things like bread, rice, pasta, soda, desserts, even some fruits, your body breaks them down into glucose, which is a type of sugar. Then your pancreas releases a hormone called insulin. Insulin works like a key. It helps move sugar from your bloodstream into your cells where it can be used for energy. But in diabetes, that system stops working properly. Either your body doesn't make enough insulin, or your body stops responding to insulin the way it should. And when that happens, sugar starts building up in the blood. This is where it gets dangerous. Because high blood sugar can slowly damage your blood vessels, nerves, heart, kidneys, eyes, and even your brain. And many Americans experience this without realizing it. Concern tone. The most common type is type 2 diabetes. This is the form doctors see every single day in clinics across the country. Type 2 diabetes usually develops slowly over time. In many cases, people have it for years before they finally get diagnosed. And the early symptoms can seem surprisingly normal. You may feel tired all the time. Your vision may become blurry sometimes. You may feel extremely thirsty. You may notice you're urinating more often. Some people suddenly start getting frequent infections. Others notice cuts and wounds healing very slowly. And here's one symptom most people never connect to diabetes. Feeling hungry even after eating. That happens because your cells aren't getting the energy they need properly. So your body keeps asking for more food. But here's the surprising part. Some people have almost no symptoms at all. That's why diabetes is often called a silent disease. Doctors often discover it during routine blood work. And the scary part is, by the time symptoms become severe, damage may already be happening inside the body. Slight pause. So why does diabetes happen? There isn't just one cause. Usually, it's a combination of genetics, lifestyle, diet, weight, age, and activity level. If you have a family history of diabetes, your risk is higher. If you sit most of the day, eat a highly processed diet, sleep poorly, or carry excess body weight, especially around the abdomen, your risk also increases. But this is important to understand. Not everyone with diabetes is overweight. And not every overweight person develops diabetes. That's one of the biggest misunderstandings people have. Diabetes is much more complex than people think. Stress can also play a role. Poor sleep can affect blood sugar control. Even chronic inflammation inside the body may contribute over time. Doctors see this every day. People often think diabetes appears suddenly. But in reality, the body may struggle with blood sugar for years before a diagnosis finally happens. This stage is called prediabetes. And millions of Americans are currently living with prediabetes without knowing it. Prediabetes means blood sugar is higher than normal, but not high enough to officially be called diabetes yet. And this stage is incredibly important. Because lifestyle changes during prediabetes can sometimes prevent or delay full diabetes altogether. Reassuring tone. Now let's talk about something many people fear. Can diabetes actually become dangerous? Yes, absolutely. If blood sugar stays uncontrolled for long periods, serious complications can happen. Heart disease. stroke, kidney damage, nerve damage, vision loss, poor circulation. And in severe cases, people can develop dangerous infections or wounds that don't heal properly. What happens next may shock you. High blood sugar can even damage nerves so slowly that some people lose feeling in their feet without realizing it. That's why doctors strongly encourage regular foot checks for diabetic patients. And here's another important point. Diabetes also increases the risk of heart attacks. In fact, many people don't realize diabetes is deeply connected to cardiovascular disease. Now the good news. Diabetes can often be managed very effectively. And many people live long, healthy lives after diagnosis. The key is catching it early and staying consistent with treatment. Doctors usually diagnose diabetes with blood tests. One common test is called the A1C test. It measures your average blood sugar over the past few months. There are also fasting blood sugar tests and glucose tolerance tests. These tests help doctors understand how your body is handling sugar. Now let's talk treatment. For some people, lifestyle changes alone can make a huge difference. That includes healthier eating, regular exercise, weight management, stress reduction, and better sleep. Even moderate physical activity can help your body respond better to insulin. And you do not need extreme workouts. Simple daily walking can help significantly. That surprises many people. Emphasis. Small consistent habits matter more than short bursts of motivation. Now, some patients also need medication. And in some cases, insulin. There is absolutely no shame in that. Diabetes treatment is not about failure. It's about protecting your body and preventing complications. Modern diabetes medications have improved tremendously over the years. Doctors now have many tools to help patients manage blood sugar safely and effectively. But here's something extremely important. Never ignore symptoms because you're afraid of the diagnosis. That fear delays treatment. And delayed treatment increases the risk of complications. Concern tone. So when should you seek urgent medical attention? If you have severe weakness, confusion, chest pain, difficulty breathing, severe dehydration, vomiting, or very high blood sugar symptoms, you should seek emergency care immediately. And if you suddenly experience numbness, vision changes, or signs of stroke, do not wait. Get medical help right away. Slight pause. Now let's talk about prevention. This is the part many viewers can start today. You do not need perfection. You need consistency. Start by reducing sugary drinks. Soda, sweet tea, energy drinks, and excessive juice can dramatically raise blood sugar. Try drinking more water. Eat more fiber-rich foods. Vegetables, beans, oats, nuts, and whole grains can help support healthier blood sugar control. Prioritize protein. Limit ultra-processed foods when possible. Move your body daily. Even a 20-minute walk after meals may help blood sugar levels. And one of the most overlooked health tips of all. Sleep. Poor sleep affects hormones that control hunger and blood sugar. Many Americans underestimate how strongly sleep impacts metabolic health. Stress management also matters. Chronic stress raises cortisol levels, which may affect blood sugar regulation over time. Simple habits like walking, deep breathing, mindfulness, or regular routines can genuinely help. And remember, you do not have to do everything overnight. Small changes done consistently often create the biggest long-term results. Reassuring tone. If there's one message I want you to remember today, it's this. Diabetes is serious, but it is manageable. And early action can change everything. Most people ignore the early warning signs because they seem minor. Fatigue. Thirst. Blurred vision. Frequent urination. Slow healing. But your body may be trying to tell you something important. Listen to those signals. Talk to your doctor. Get routine blood work. And take your health seriously before complications develop. Because prevention is always easier than damage control. Slight pause. If this video helped you understand diabetes in a simpler way, subscribe for more simple health explanations. And remember, small healthy choices today can protect your future for years to come.